Hi, this is Piyush Bhargava and I have an interesting case to share with you. So let's start on the left. We have a whole body rotating image from an FDG PET CT. This is a patient who presented with abdominal distension and abdominal pain. They underwent a CT scan of the abdomen and pelvis which showed peritoneal carcinomatosis. We have a representative image here in the middle at the bottom showing ascites and abnormal soft tissue consistent with peritoneal carcinomatosis. When this was drained, instead of a carcinoma, they found diffuse large B-cell lymphoma, changing the diagnosis to peritoneal lymphomatosis. So let's look at the rotating image. The rotating image, as you can see, shows diffuse hypermetabolism in the abdomen and pelvis and linear increased uptake around the liver. Now, this rotating image also shows another abnormality, which is in the right upper extremity, a linear focus of increased uptake with some focal intense uptake in the distal or the more proximal aspect. On the middle top, we have a fused PET CT image showing intense hypermetabolism in the ascites and the abnormal tumor tissue in the peritoneal cavity, consistent with peritoneal lymphomatosis in this patient with diffuse large B-cell lymphoma. Now let's look at this patient's chest X-ray, which is on the top right, which shows in the region of this linear increased uptake that we saw on the PET, that this patient has a right upper extremity PIC line, and somewhere here in the proximal aspect of it, we see focal intense uptake. Now this is suggestive of catheter-related thrombosis. So this patient underwent an ultrasound which showed a non-occlusive thrombus involving the mid-right subclavian vein around the catheter. So the catheter is seen here as a linear hyperechoic focus, and then around it we see a thrombus, and then the thrombus is not completely occluding this subclavian vein. So the two interesting findings of this case are peritoneal lymphomatosis and catheter-related thrombosis. Here is an interesting article on imaging of common and uncommon peritoneal diseases, and they talk about peritoneal lymphomatosis as intraperitoneal spread of lymphoma, which is typically seen with diffuse large B-cell lymphoma and Burkitt's lymphoma. There is associated retroperitoneal and mediastinal lymphadenopathy in these patients. FDG uptake correlates with aggressiveness of lymphoma, and FDG PET is useful in target selection for biopsy, evaluation of treatment response, and detection of malignant transformation. Thanks for watching.